Students need it too. Everyone's getting this thing called text neck. Everyone's on that phone. Students and teenagers, they heal a lot faster. Their bones are still growing. I mean, you're 21 before your bones fuse. Chiropractic is best used as a preventative measure. Of course, it can help you deal with a lot of conditions. I've helped many people avoid surgery. I'm talking hundreds of people avoid surgeries.
Oh, that's important.
So many people watch the videos and they come and they show me also the videos they're watching. They're like, I like this sound and I want this sound. First of all, everyone's sound is very different, okay?
Right.
And that sound is nothing but nitrogen gas that is getting released between the joints.
Namaskar. Welcome to the Meeting Point podcast. I'm Sarika Vasudev, your host for today. And this episode is all about chiropractic. I'm sure many have this question about what is chiropractic? Do they really crack the bones? And is it painful? How do they do it? And does it work only on the spine, or does it affect the other parts of the body, etc., etc.? So many questions people have, whomever I've met. So this episode is going to clear a lot of your doubts and myths and answer your questions. So our guest is Dr. Kruti Vora. She's trained in the US, extensive training on this practice. And she's based in India lately, and we've invited her for this podcast. So let's begin the conversation. Hi, Dr. Kruti. Welcome to the Meeting Point podcast.
Hi, Sarika. Thanks for having me.
What does a chiropractor do?
Right. So chiropractic, which, and I think people have heard on social media. I think there's lots of viral videos that are getting circulated. A lot of people showing some techniques and moves, which with all the oohs and ahs and the cracking. Yeah. So I get both actually in my office. People who are very fascinated by it, and then people who are very scared by it.
Yeah.
So, it's not portrayed, I think, completely on social media but it is more than just entertainment. So what chiropractic really evolves around is the study of the spinal cord, right? The spine and the nervous system. So I have a model of spine over here, where I talk about, the brain is connected to the whole body through the spinal cord.
Yeah.
So information is getting passed both ways. And the spine's job is to protect, right? The bones are to protect the spinal cord.
Correct.
And so, it's not due to daily activities and stuff, things move out of alignment, can cause these nerve pinchings. And we call it as neck ache, backache. And, we don't know what it is just yet. And we'll talk more about this as we go on in our conversation. And so what a chiropractor does is checks your whole spine out, finds the spots where those nerves are getting pressed, and then uses a manual technique to adjust those bones to remove the pressure of the nerve. If I had to summarize, the goal of a chiropractor is find where the bones are out of place and remove the pressure from the nerve. And the body should return to functioning the way it is designed to. That is a chiropractor, yeah. And if we go into the chiropractic definition itself, it's a Greek word, chiro meaning hands, and practic meaning to do.
I wanted to ask that.
Yeah. So it means to do with hands. So traditionally, chiropractors are practitioners who use their hands to treat patients, and it has evolved over a period of time to include instruments and other sort of devices and techniques. But that is more of the modern day age, to be able to give a more comprehensive care. But if you look at the core principle of it, it is manual. Yeah, it's always manual.
Hands.
Yeah.
Okay.
Yeah.
Wow. But do you really need to be so strong to put that pressure and like crack the bones or something?
So it's so funny that you asked me that, because sometimes patients at the end of my session are like, oh, you must be tired. Or, I've got gentlemen who are over 6 feet, over 200 kilos.
Yeah.
And believe it or not, I can treat them too. So the study is so intense. We study each bone individually, the shape of it, the angle of it. And then suppose you're taller, your bones are going to be slightly longer. So it is our technique, it's our way of finding it with our hands and then knowing which angle to drive it. It's like playing golf. You don't have to put a lot of force. You don't have to be very muscular. You need to know your line of drive. So we actually call it line of drive, that adjustment, that line that we are going to thrust the bone into. So when you have that angle right, I would say I put maybe 5 kilos of pressure. That's it.
That's it.
That's it. You need to know how to isolate the joint you want to move and move it. It's a small bone.
Gosh. Wow. But then even palpitating, because you know what? I remember my first visit to you. I had walked in. I started telling you about it, and you just you asked me to turn around, and then there you were, like already scanning, and I was like, oh wow. Is it so obvious from my clothing where I have tightness? So that observant you guys have to be, right? To figure out what could be an issue.
Yeah, it's kind of like, you kind of have to know what's going on behind the curtain. The curtain might be the body, but the
Yeah.
spinal cord and your whole organ system is connected to it, is
Right.
also behind the curtain.
Right.
So we have to study to look beyond those and even look for the signs and symptoms. Like you go to a medical doctor and you will say, okay, I'm having fever. And they diagnose you with that because they can say, oh, you're having flu or something like that. How can he look at you and just tell you that immediately, right? Because
Right.
he knows how to look for those signs, like he looks into your mouth and that sort of stuff. So for us, it's the same way. We check the spine, right? So we run our hands through it and we look for those imbalances in the muscle. The body is designed to be straight and even, but it doesn't work that way. I mean, not because of our normal use, the way we use it.
Yeah.
There's lots of telltale signs. So a doctor who is experienced in that can figure it out. I personally have been in this field for 10 years now, and I have treated more than 14,000 patients in my lifetime. So it's just a second-hand nature kind of to me right now, but it's something that you build up over a period of time.
Correct. Correct. Wow.
Yeah.
Now, so what sort of education does one need to undergo to become a chiropractor?
Right. So chiropractic is, in terms of chiropractic, it is running parallel to a medical doctor. It's actually the equivalent to an MD degree in the US.
Okay.
Yes.
Okay.
So it's, I'll draw some parallels and then I'll show you the differentiation as well.
Yes,
because there is a lot of misconception around what chiropractic degree is, and it's a proper doctorate degree, which is a postgraduate degree, which means that you've already done your undergraduate in your field of science and finished those prerequisites. So for me, in my case, it is a bachelor's of biology with pre-medicine, and that's 4 years after 12th.
Okay.
And then after that, we go into chiropractic.
Okay.
So in chiropractic, we have different subject matters, and we approach understanding the body first before we are even allowed to touch the body. That they have a very strict rule about that.
Okay.
So to understand, we take an approach of inside out. So we start off initially with the inner layers. We learn what those nerves are, what do they look like, and we spend 9 months just learning anatomy, the anatomy of the human body. If I'm just touching you and I have no idea what a muscle even looks like,
Correct.
how could I possibly visualize it, right?
Correct.
Because I can't go and cut up every patient to see which muscle is tight.
Correct.
Right. So that same way, we have to, we learn that. Then we go into palpation. So one interesting thing that we did in palpation, which doesn't make sense to a lot of people, but remember when we had those phone books?
Phone books?
Yeah.
Okay.
Yellow pages.
Yeah.
I mean, I don't know here, but in the US, we have phone books.
We did
so,
have, yeah.
What we did in school is we took a piece of hair.
Okay.
And we put it on, we opened the book and we put it on there, okay? And then we would put one sheet of paper and we run our fingers on it. Do I feel the hair? Then we put another. We keep adding the pages. It's kind of like the Princess and the Pea story. You see how, that one small pea on that layer of mattresses, the princess could still feel it and couldn't sleep at night? That's because she's very sensitive. So we build our sensitivity, right? Not sensitivity, but sensitivity to feeling for the body. Because I can't run for biopsy, I can't run for MRIs. I mean, as a matter of fact, I personally take an approach of least invasive first. Unless there's no need to, we're not taking x-rays, we're not going to take MRIs. And this is something that I think people find anywhere in the world where the doctors just go ahead and send for diagnostics. Now, of course, there are cases where I do request them first because we want to minimize any chances of risks, because we might not be treating something that we are personally, like as a chiropractor dealing with, right? So we as chiropractors deal mostly with the neuro, muscular, and skeletal system. Those are the 3 systems of the body. So technically, I don't treat with cardiology. But suppose you're having a chest pain and I'm thinking, oh, it's maybe your ribs and I'm treating your ribs, but what if it was a heart issue? So in a case like that, I would first ask for X-ray or MRI or send you for an echo, something like that. So
Right.
I would be very vocal with my patients for this. Yeah, I think that I like to drive my patients to a conclusion, and they're part of the process. It is not that I tell them what to do. I will first analyze, like you said, I see, then I feel. That's the next step I did with you, right? I had you lay down
Yeah.
and I worked on it. I stressed those joints. I see where you were really stuck. The
Right.
body is designed to move. The problem comes when it gets stuck.
Correct.
That's what we are here for. And once we get it moving, you should have function back again. Yeah. So that's how it goes. And then we discuss what could be the possibilities of what are we dealing with, what's going on, and then we either send you out for taking the tests or we'll go ahead and do the treatment. Mostly, I think 95% of the cases I go ahead and do the treatment because if it's all clear. And then we talk about what are the next steps. Why did you come here in the first place and what you're going to do to prevent from being back in the same position.
Right.
So that's my short form approach of how I treat my patients when they come in.
Okay.
Yeah.
Wow.
Yeah.
So going back to education, you have to go into such detailed study to be able to do all of this.
Absolutely.
Like 9 months of just study of anatomy.
Just anatomy, then 9 months of palpation, then 9 months of, we even do neuroanatomy. Like we have separate 2 semesters just dedicated to studying the brain. And we never touch the brain, right? We can't really go through the skull to touch the brain, but we have to understand how the nerves function. And it's far complicated than what is visible to the naked eye. Even when you dissect it, you don't realize how many parts there are to that organ specifically. So we spend time doing that. Then we also do, of course, basic sciences. I've got cardiology, nephrology, dermatology. We cover all the subjects. We do a lot of diagnostics, which is where our MD and the DC, which is the Doctor of Chiropractic programs, differ. They do pharmacology and we don't. There's complete elimination of that.
Correct.
But that subject is caught up with radiology. We do more MRI, CTs, and X-rays. So I'm also able to take those images if I need to. And we practice that with our patients a lot while we are learning in this process. So we have very hands-on experience on the whole process from beginning to end, what our patients themselves are going to go through. In the meantime, when we're doing all of that, and then we go into techniques. So the techniques comes right after that. Once you are with techniques, you start seeing patients, like, residency and rotations and that sort of stuff.
Okay.
So again, all of this while simultaneously taking board exams. So our board exams come in after a certain period of time. So we finish our anatomy. So anatomy board exams are going to come first. So these are national board exams. And there are 5 of them that we have to take, which includes physiotherapy. So I'm also a licensed physiotherapist.
Okay.
And that allows us to be able to understand the body and treat it from as many ways as possible. So it is a very labor intensive.
Yeah,
I would say
I can
that
imagine.
I personally did not have any back pain until I went to chiropractic school. You're sitting for 8 hours a day in the same chair, and it can get to you. It can.
Yeah, I'm sure.
So imagine, your studies, patients, and boards. Those are the things you have to do simultaneously. It's one of the hardest things to do. And honestly, I'm so happy that I did that, because if I know I could do that, going to work for me is just fun, because now I actually see the results of all of the work that I've put in. So that's where, in the US, chiropractors are primary care providers. Patients sometimes will come first to the chiropractor before they go to medical practitioners.
Okay.
So we have to be able to either treat them or direct them to the right doctor. So it's important for us to understand all of the different conditions that the body will face, which conditions we're not allowed to treat, which conditions we shouldn't treat. So that sort of stuff, we are already we are primed for it. And if you look at total classroom hours required, it's 4,200. 4,200 hours we have spent in class.
Wow.
Yeah. It's a long time. It's a 4 years of just dedicating ourselves to showing up and taking it and our exams. And of course, we have semester exams in between, like for each class. So those are 2 different things. So yeah, when you see a doctor, it was made under pressure like diamonds. We go through so much pressure, and then we get to really enjoy our craft and be able to make changes to our patients' lives.
It's a fabulous practice, honestly.
I love it.
Yeah. My first experience was, there used to be an Australian doctor here in Pune. Okay, I think he was above 70 years old. And I went with a friend. She wanted to take his treatment, so I went along with her. And I was watching him, do the adjustments, etc., etc. And I was quite fascinated, like, oh, wow, and everything. And but at the same time, it was scary for me to
Yeah.
look. Okay. And then after she was done, he says, "Now you come." I'm like, "No, no, I'm not the patient. I don't need it." He says, "No, no, no, you come, sit." And I was like, "Oh my God, what is he going to do?" Because the first image that comes to my mind is people doing this
Yeah.
adjustment, and I'm very scared. Like, I don't know, what do you do with the neck?
Yeah.
What if something goes wrong?
Yeah.
And I'm just talking to him, and generally I'm sitting. He made me sit. He palpitated and everything, and he just did some adjustment.
Yeah.
I'm like, okay. And then another one, and I'm relaxed actually. If I tightened my body, probably it would have had adverse effects. Uh, but after whatever he did, it felt so light. And I didn't realize, oh my God, the spine had so much tightness. You know?
Yeah.
He's like, now you feel good? I'm like, yeah. I was in a daze. How good I felt with that. So that's my first impression and experience of going to a Cairo. After that, it was like, okay, I think I can manage it. Why am I narrating all this is, I was completely unaware of my first experience. But if a layman has to come to you or go to any Cairo, what should they expect? What questions should they ask, or how should they go about it?
That's actually a good question. Many people don't ask this question before they go in. So I'm glad that I can get this information out there and get people ready for it.
Yeah.
What I have noticed, and I've worked, in several different practices, and currently I'm in India, but I was working in the US. So I have a very strong background in how it is performed and how it is expected. See, in the US, it's a very regulated system. There's so many things I can and can't do, and everything has to be documented because communication between doctors or the documentation represents everything that you've done. If I've not written it down, it's considered not done, and you're held liable for it. So I personally take that kind of care, which some doctors may or may not hear, but that's what you would expect out of me, that I ask you the right questions. Now, see, until the patient has come and seen the doctor, the whole responsibility is on the patient. That is the doctor the right person for them to go? So if you're asking me that, hey, if I saw a video online and I want to reach out to a doctor, and what are the questions I need to ask? Firstly, you have to make sure that you ask them, I have this problem, do you treat it? Right? Get that information first, listen to what they have to say. Then you say, what does your plan look like? So each patient is going to have something different. If you come and ask me and you say, hey, Dr. Kruti, can you tell me how many sessions it's going to take? I've never seen you. How am I going to know? And that goes for any field, any doctor. So you have to run your diagnostics and consultation first. But it's important to know what service are they providing. I've seen lots of doctors provide, like 5-minute services or add on extra therapies and stuff, which may or may not be required. And they don't really inform that to the patient. It's more like they come in for their first session and then they say, this is what you have to do. So that's something you have to, I think, preemptively ask. I think that, you talk to your doctor and you say, like, how do you structure your follow-up treatments? And how can we approach it better? And the other question to ask is, if I have questions, how will I be able to get in touch with the doctor? Now, you're going to get two responses because there's some practices who have lots and lots of patients. So you can't directly get in touch with the doctor. But you want to hear a response like, you can ask your questions to the doctor when you come in for your session. Make sure that you ask your questions to the doctor. Because I've seen a lot of my patients, before they came to me, get deferred, and they're asking questions to a junior or to the front desk, and they're not the right person to give you advice.
Correct.
I want to make that very clear right off the bat, because they respond based on what they've heard or what is the normal practice, and your treatment is not determined by the person who's sitting in the front desk. It isn't. And don't give that power to those words. They mean well for you, but they don't know as well as the doctor knows. So either you have an opportunity to get in touch with the doctor, or that you can come back and have a sit-down consultation as part of your treatment. So that's something that I provide, because I feel that an informed patient is a healthier patient.
Right.
That's my philosophy.
Absolutely. Absolutely.
And see, the spine is only a part of the body. It's a very important part of the body.
Yeah, yeah.
You can transplant any part of your body, but you can never transplant a piece of spine.
Yes.
Doesn't exist. So you get one shot at it. Let's take care of that.
So when should a patient come to you? For that matter, like, when should I think that, okay, you know what, I think I need to go and see a chiro?
So in the US, we have a saying that who is the perfect patient for chiropractic? And we say anyone with a spine.
Okay.
I have adjusted newborns.
Wow.
Yes.
Okay.
The trauma of birth is one of the biggest traumas in life. Can you imagine a baby getting pulled with forceps and this pressure has been put on the spinal cord? So I have adjusted. I've adjusted women through the last day of pregnancy as well. It helps for the because the bone is restructuring itself, right? The whole hips, the back, it's
Correct.
holding so much weight so fast, right? You gain weight so fast. It puts
Yes.
pressure on the lower back. And the hips are opening up. And we want to make sure that it closes back up in the right place too. I've had a lot of people go through epidurals and stuff and not realize until 10 years after that was the reason why they've had a low back pain.
Right.
So that's why you need a really good doctor who is not just a doctor but also an investigator. Because I look at everything with an eye of suspicion and I ask more questions. If your doctor is not asking you enough questions, then maybe you should be.
Right.
Yeah.
Wow.
So so who should come in? Really, everybody needs it. And I'll tell you why. Because the world that we live in is becoming more and more complex and stressful by the day. And our body is not designed for it. We're not designed to sit in one place for 6 hours, 8 hours even for some people. I have patients coming in with 14 hours of sitting job. We're not designed to stand for 10 hours and cook food. We're not designed to, stress. Our body is designed to handle 15 minutes of stress at one shot in one day.
That's it.
That's it.
Okay.
So think about your stressful thoughts.
We are constantly in it.
I mean, right now, I could be thinking about, what am I going to have for dinner? How am I going to go prepare my meal? My next meal. Where's my next meal coming from? Or I'm thinking about, if I wake up in the morning and I'm going to work, I think about, when is my patient coming? Am I going to make it on time? I need to do this and this. There's research that has shown that we've had 70 plus stressful thoughts from the time that alarm goes off, which itself is a stress, to the time that we show up to work. 70 stimulus, which just raises an alarm. What else is an alarm? It's our body kicking into, I'm in pain, or something is wrong.
Constantly being in fight or flight mode. Yeah.
We're constantly in that fight or flight mode, exactly. And that's not what we're designed to do. So it's no wonder we have things like chronic obesity, chronic inflammation, chronic degeneration. Because essentially, just like any other machine, the more you use it, the more it wears out. So I always feel that you should get chiropractic throughout your life. How frequently you get is going to change based on what is going on in your life. Your lifestyle is a very important component of getting care, and students need it too. Everyone's getting this thing called text neck. Everyone's on that phone. Students and teenagers, they heal a lot faster. Their bones are still growing. I mean, you're you're 21 before your bones fuse. So children are born with more bones, and then adults have. So that fusion is still going on. Their growth plates are still growing. You got a chance, and that's why I say that this kid is just a child. What's the point? He doesn't need a chiropractic care. And I'm like, honestly, a trip, a fall, trauma, riding a bicycle and falling and not realizing it. I had a gentleman come in the other day and he was complaining of a hip pain. And it just said that it came randomly and it was not related to anything. And I did a little bit of digging around. He had apparently fallen from a roof 15 years ago, but he said he was fine. At that time, he was 25. So he said he didn't go to the doctor. He felt soreness for a couple of days and that's about it. Now imagine the trauma to the spine, which might have shifted the bones, and then the body goes into protective mode and it was not released properly. And so the body adapted, because the job of the body is to constantly adapt to the changing environment. When you go to cold, your body will heat itself up. And when it's warm, it cools itself down, because it's constantly doing all of this stuff, whether you pay attention to it or not.
Right.
So I think it got overlooked at that point. He was fine in a few days, he claims, and he never had any issue. Now what he is going through is that he's riding a bike, and I think he might have had a jerk recently, which aggravated an old pain, which was buried there but buried. because the body is not paying attention to it. If it's constantly worried about the pain, it's not focused on what's ahead of it. So if I'm riding a bike or even if I'm working, my deadline is more important than the pain. That's how the body is, or rather the mind is overruling the pain signals. And when you do it enough, then it gets numbed out. And that's where the problem comes. So it's very difficult for me when you ask that, when is the point to come? I say that you should always get checked, as a preventative, because we are into prevention rather than cure.
Okay.
Chiropractic is best used as a preventative measure. Of course, it can help you deal with a lot of conditions. I've helped many, many people avoid surgery. I'm talking hundreds of people avoid surgeries.
Oh, that's important.
Very much so. Again, you tell me, answer it in short. I will say, when the fire alarm goes off, you gotta go see the doctor. If you have any aches or pains, and this is my rule of thumb, even with my patients who are getting current treatment, if you have any new pain, wait for 3 days, 3 to 4 days. If the pain goes away in that much time, then don't worry about it. It's probably something, minor that has happened. But if you notice that the pain stays beyond its time, it's welcomed, or even if it's interfering with your daily activities, that you can't go to bed, you can't go to work, please come and get it checked out. And when we look at pain, everybody has a very different threshold. What you might be sensitive to, I might not be. As a matter of fact, I cannot tolerate any pain. I cannot. And that's one of the reasons why I'm in this field, is because pain is so distracting from doing what I want to do. If I was speaking to you and I had an itch in the back of my back, I would not be paying attention to you. I'd be paying attention to that, right? So when you have pain, you're actually living lesser quality of life. That's what I see, because you're actively focusing on eliminating a signal which exists.
And you're limiting yourself from doing something that, what if that happens? So there's a what if all the time hanging on your head. That's how I also look at it.
There is.
Yeah. Okay. So I have so many questions.
We might have to do a part 2 for this. I think there is so much information and misinformation about chiropractic out there that we need to narrow it down to really understand what chiropractic doesn't mean for everyone, but for you, in your case.
Yeah.
Because it's not one size fit all. And if you find a doctor who's doing the same treatment for everybody, I say turn around and run. He's not listening. You need to find a doctor who listens to you and gives you the treatment that you need. And that's going to change your life.
Yeah. So whatever you said earlier, continuing with that, who should come and who should not come there?
Things like people who have cancer, we definitely avoid. We should not get chiropractic care, because we don't know how the whole system
is
going to communicate with each other. So fractures, never get chiropractic care. If you know you broke a bone or you dislocated a shoulder, don't get chiropractic care. I know they show it online, just shoulder has gone down, you just pop it back in place. No, don't do that. We're not treating dislocations, because that's a little bit more complex, that requires imaging. And don't go for a quick fix. Chiropractic, if you think, is a quick fix, that the way they show that a person is cracked in their back and a bent over person is walking straight, it's never like that. So if anyone tries to tell you or gives you a guarantee that in one session you're going to get to the point where you need to be, it does not work that way. It doesn't. So again, those are one of your red flags of the doctors that you might want to run away from. Because to get to that stage, it took a long time. So getting out of it will also take time. For example, a tummy ache. You might have a stomach ache and you might think like, what does a chiropractor have to do with it? But just remember that the nerve that goes to your stomach is also coming from your brain and through your spinal cord. If there's a compression over there, or if there is some tension, because the stomach nerve is actually coming from your mid-back, and most people have a mid-back issue because they're sitting all day long, right? Posture related. So that could help alleviate some of those symptoms. But to what degree and when, that only a doctor is going to be able to look at you and tell you in your case. Research shows that 90% of individuals around the world are going to have back pain at some point in their life. I have many patients that just get up and say, I feel so fresh. And I don't know how to describe fresh in terms of pain, but they do feel fresh. And it's a reset. We just reset the nervous system and we get the body to do what it needs to do.
It feels amazing.
I love it.
Yeah. I told you, right? The first experience, I was like, oh my God, was my spine so tight? And I thought I'd do yoga. I'm so flexible. I can touch the floor with my hands flat, whatever, all of that. How can my spine be so stiff? Or there could be any tightness. But that's small. I mean, he didn't even do a detailed work like he did on my friend. But it felt so good in the spine, and I was like, oh wow, this is how it feels.
Yeah. And that's what it should
You
feel.
know?
That should be your
That's
new
how you
normal.
should. Yeah.
But we've gotten so used to it. So circling back again to your question, if you are having that sitting job, that stressful, high intensity job, um, and even if you don't have a job, maybe you are a student, maybe you are a housewife, I think everyone can benefit from at least one session of care, because that will help reset the nervous system and give it a new starting point. When you are 50 years old and they say a lot of degeneration has already set, then I really can't reverse, and I don't think anyone can. You cannot reverse degeneration.
Cannot reverse.
You cannot reverse a cavity, can you? It's a bone, and you cannot reverse it. Once that has happened, it's happened. So we want to prevent it. But what chiropractors can do after the fact is restore your mobility and importantly restore function. If I've had gentlemen come in who was 82 years old, I believe, and he came in because he's been getting physiotherapy care, and somebody had told him about me. So he decided to just come get it, and he had just finished 30 sessions of 30 sessions because
Wow.
the doctor had told him he needs to come in daily for 5 days a week. Week after week.
Wow.
And he finished his 30 sessions, and then
And then
he
he's
came
coming
into
to you.
Yeah, because I think he was very curious that what else can I do for it, because it was still bothering. Remember, he's 82. So I was not expecting that he would have been at 100% pain-free or recovery,
Right.
even after 30 sessions.
Right.
So he came in and he just wanted to see what's something different that I can do for him, because 99% of my patients have got chiropractic for the first time with me.
Okay.
And that's what excites me. And that's why I'm in India, because I love that face right after an adjustment, like that,
Yeah.
what you experience.
Yes.
To see, like, I feel so good and I deserve to feel that good. So when he did that, he thanked me for it, because he said what 30 sessions couldn't do, he was able to do it, get it done for me in one session. And then he came back again to tell me that for the first time he was able to pick his granddaughter up
Oh wow.
and
That's
play
sweet.
with her.
That's sweet. Yeah.
Now, we never think about that. We say, oh, the person is elderly, we should not, we start reducing, you should not bend, you should not do this, you should not do that.
Yeah.
I'll tell you another story which really is close to my heart as well. There's a gentleman who was 52, I think, 52,
Okay.
yeah. And this happened during COVID, and I think it was just a back muscle or something that went into a spasm. And the orthopedic doctor said, take these medicines and never cross your leg and sit on the floor. I don't know why they say that. So he was scared. And of course, the pain went away, because you're taking a medicine, the pain is going to go away. And then never sat. Now 3-4 years have passed in this scenario, when the pain somehow resurfaces, and now he's in front of me. And I said, but I don't understand. After I did my examination, I'm like, no, the body's actually quite flexible. Why would you not cross your leg and sit on the floor? Within the first session, the patient was able to cross the leg and sit on the floor. I did not even treat the leg, by the way, only the spinal cord. That is not
Okay.
even the best part of the story. I don't care if you can cross your leg or not, to some aspects. But what the patient said after to me was, for the first time, I sat down and had a meal with my family, because their family practice is such that they all sit
Sitting.
down and eat.
Oh, okay.
That's more important for me. Those are things that tell me that I have achieved a success in my care. Otherwise I would just say, you've got pain, take a painkiller. My competition is not any other doctor. I recommend you go to the doctor that you work really well with,
Yeah.
that
yeah.
listens to you and you think can address your concerns. But my competition is really,
Ignorance. And
ignorance and painkillers. Like the 10-cent cheap
or muscle
painkiller.
relaxants even.
Exactly, those are painkillers.
Okay.
And that's what they do. They turn off your nerve. Now you think that you're better, but that compression was never resolved. Compression is a physical force. So we have to treat it with a physical force. We just turned the nerve off. We just shut off that signal. We just pulled out the battery from the alarm. That doesn't mean there's no emergency.
Wow. Okay.
See, the brain is so complex. It is doing thousands and thousands of functions right now without you even thinking about it. You're not even thinking about breathing, but it's breathing. You're not even thinking about eating, but it's digesting. But you've had tummy ache before. That's when something's not working in the body, signaling to you. It's trying to bring to your attention. You need to do something about it. So these functions are continuously going. When there is a pain, the body knows and it's fighting it. So we take painkiller for 10 days, 15 days. Why are they prescribed for 10 or 15 days? Because that's how long the healing process takes in between to bring that inflammation down.
Okay.
The body is working in the background. It's just not signaling it to you. So that signal system hasn't turned off, body is still healing. The problem becomes is that, like I said, if it was a physical problem, then I need to remove the pressure from that. Now, I don't want it to get used to it. We are making our body used to limitations. And I want you to live your life limitless. That's where the differentiation between medical and chiropractic field comes in. And chiropractic has fundamentally been integrated into the American, because it was founded in the US. And believe it or not, it was founded the same year that X-rays were discovered. It's been around that long.
Okay.
Yes.
Wow.
And we have a very significant history because we have fought to bring chiropractic, to make it accessible to everyone, and now worldwide. That's part of my mission, is to bring chiropractic here. I believe I'm only one of maybe a dozen or so chiropractors in India, licensed board-registered chiropractors.
Wow.
Yes.
Okay.
So, for me, credentialing is very important. I don't want to go to a doctor, who has been through a workshop on how to adjust, because there's more than just an adjustment to chiropractic.
Right.
It's a lifestyle medicine. That's how I like to see it. We address the whole body and its well-being.
Yeah, yeah.
So that's what it's been in our over 125 years now. It's been in our system. Chiropractic is very well understood and researched. That's the other thing. It's clinically based. It's researched. It is performed in test groups. We check our outcomes. As a matter of fact, when we were going through our education, we had to do research to justify why I would, like you go to your doctor, my superior, right? And I say, I need to treat it this way. Then they'll say, why are we going to use this technique and not that technique? I say, because I think that this technique A is better than technique B. She'll say, you justify it with proof. Show me somebody else who has done it and got that result for you. So we start that critical thinking much before we go out and practice on our own. Yeah, and be able to even put that pressure. We call this life. See, the spinal cord is your life force. Before I introduce any force into life force, I need to know the right force that I need to introduce. So this is something that is studied, understood, and we constantly try to improve ourselves and most importantly, improve patient outcomes.
Okay.
That's the end goal, results.
Wow, this is so fascinating. I'm going to go to the most basic fundamental question. Like, when people hear about a chiropractor, the first thought that comes to their mind is all the cracking sound it makes.
Yeah, very satisfying, even for me.
What is it about? I mean, what happens? Why that sound comes? What do you do? Like, the pressure or the release or whatever that you do. What is it?
Okay, that's a good question, which I think that I'm glad you brought it up, because I think everybody has this question.
Yeah.
And so many people watch the videos and they come and they show me also the videos they're watching. They're like, I like this sound and I want this sound. First of all, everyone's sound is very different, okay? And that sound is nothing but nitrogen gas that is getting released between the joints. So joints hold gas, and it does get refueled after some time.
The gas.
There's a gas in that joint capsule, and that gets refueled after some time. So the sound itself does not mean that an adjustment has made. How many times we do? Yeah, this is not an adjustment.
Yeah, but this is a gas.
This is a gas, but it's not an adjustment.
It's not an adjustment.
Correct. So just because you get a sound does not mean an adjustment has been made. You've just basically tractioned it out, right? You've opened that joint, so gas gets released, and you're hearing that sound.
Okay.
So that's what it means.
Why is it there in the first place?
The gas, it's just part of the biochemistry of the joint space and how it functions. The joint is to make sure that you get proper movement, and that's about it. It's just the anatomy of it.
Just the anatomy of
it. Yeah.
Okay. So when you're doing the adjustment, that's the sound.
That's the sound, and you won't always hear the sound.
Got it.
There are some people who are like, on the larger side, and they have no sound.
Okay.
Yeah, but things move, and I'll tell you, as a patient, you will feel it on the inside, because when the bone moves, you can attest to it. You feel it on the inside, the vibration of that movement.
Yeah.
And sometimes you get a very loud sound, and sometimes it's not so loud. Sometimes the neck is very loud, and sometimes the neck is not, because necks have the small bones. So sometimes you don't get that. So it's not even proportion to body size. It's not proportion to height. There is no correlation. It's just everyone's body is very unique, and that's how we have to treat it.
Okay. So, and when you do the adjustments, spinal adjustments or vertebrae or
Yeah.
whatever, so are you pushing it back in its place? What is happening inside?
So that's what. Let me explain it to you in a different way. We say that these are misalignments, and they happen for three reasons, right? We have the three T's: the thoughts, the traumas, and the toxins. So thoughts being like stress, like the different thoughts that we have in our mind that cause our muscles to tense up and pull those bones out of alignment. Then you've got traumas, which could be an accident. It could also be sitting on your chair every day for 10 hours, day after day, year after year. That's micro trauma over a period of time. And toxins, what you put in your body. Alcohol, smoking, drugs, medicines for that matter, also weaken the system. So those cause these misalignments to happen. So they're stuck. Now, generally, your body should move. Have you ever got up from bed and you're just like twisting and turning and you hear a crack and pop? Yeah, that's normal. Your body should be able to do it. You shouldn't have to force it though. If you think you're just sitting and doing like this, that you shouldn't force it. You can send yourself into a spasm. But if you're like naturally doing exercise and moving, the body is designed to do that. But when it doesn't, it gets stuck. You will still have all function. It's hard to tell. But then you will start having that pain pop up slowly, increasingly. And it manifests in very different ways in different people. I know so many people who have so many issues, at least when I see them, and they have no complaints. So I usually and generally don't rely on patient feedback when it comes to asking if they have pain. I rely on that, as well as, because that tells me where I need to hone in on, but I also check the whole spine and I want to see what else is going on, which the body might have missed, but I can detect and help prevent further injury and degeneration.
Okay.
Yeah.
Wow. In between you mentioned about babies. You worked with babies, okay? Coincidentally, I don't know how this whole algorithm works. When you watch one reel, I guess it keeps showing you similar kind. So there is this one guy who's holding the baby in a particular position. The baby is not able to lift the head up, so he's showing what to do, what not to do, and everything. Okay, and I always think of you that time. And today's reel which I saw, he mentioned about forceps, removing the baby with a forceps, and then the baby had some impact on the spine and was unable to lift the head and stuff like that. You want to go back to that and talk a little more, because many a times after post delivery, the babies too have certain complications because of the way they were handled while
100%.
and everything, right?
So this is something we are seeing in more of our modern age, and research again is ongoing because chiropractic field is constantly validating itself through the research. I think it's empirical evidence over anecdotal evidence at this point, because there are so many practitioners and because there are so many people who are representing our field all over the world for this matter. We want to make sure that we are able to deliver the best.
Correct.
So what research has shown that there is a correlation between a forceps delivery and prevalence of ADHD in a child as he grows through the years. Because the first vertebrae, which is too small to show in this model, is actually a ring-like structure that's under the skull. Okay, so when you're doing a forceps delivery, you're actually twisting it. The first two vertebrae holds a part of the body called the brainstem, the brain, which directly connects to the brain. So when there's a twist, like imagine a towel that you've twisted, imagine the tension in that towel, and that's now in a tiny baby's brain, which was never corrected, which was never checked, which was never addressed. It creates circuits that, because the brain is like a circuit, its electrical system is up there. It creates this loops without, and because it's not having an outlet, so to speak. I'm really, trying to simplify the concept so it's easier to grasp. That's the idea. So that circuit, it keeps going in loops, and that's where we have that not being able to pay attention and follow through with certain actions. There are some cases where those muscles, because the muscle develops to lift the head, even they obviously can't do it on day one, but then we start seeing the results of it further down the line when they should be lifting their head up and they're not able to. Or the best example, really the most common, is a colicky baby.
What is that?
Colicky, when that stomach's not doing what it's supposed to do, and the spinal cord is the issue, and we think it's the stomach. We give them gripe water and things like that to ease the digestion off. Because I've seen so many patients and I've treated them. Just a simple adjustment. Babies are so easy to adjust. They really are. You just hold them in one hand, 2 fingers, and push, because they're all cartilage. And there's only very little bone and there's no force. So it's very safe. If you go to the right chiropractor, chiropractic is 99.9% safe. And that's what is off-putting for many people, because they think that, you're having my head and you're going to twist it. And I can understand the apprehension. I'm the same way too. No one comes close to my neck. But if you're with somebody that you trust, I think you get better results. And you can get better outcomes, again, for yourself.
Okay.
So with babies, going back to your point, there are lots of things that it helps treat with babies. And then babies are changing too, right? As they grow older. There's a lot they go through their toddler years and even into their preteens, childhood and preteens. So that they fall. I mean, how many times, if you think of it, did we fall? Like if I ask myself in the last 3 months, have I fallen? No. In the last year, I don't think I've even fallen once. But if you think of children,
so many times.
Learning to walk, learning to crawl, riding a bike, right? I can remember. I've fallen many times riding a bike.
Many times,
And they laugh past it because they don't know any better, and they heal a lot faster than we do. But those are all traumas that do add up. I had a young girl, she was 12 years old. And she had a bad fall, but she didn't realize it. And it actually developed into scoliosis into her preteen years. It was not significant, like where you could visually see it, but I could see it, and I was able to trace it back to that incident, because it seems that she had gone to the hospital for it, but the doctor just said that, took x-ray, nothing's broken, and passed it off as that. Whereas we should be focusing on that soft tissue component as well, or the bone positioning at that time, and monitoring it. So I think as parents, we are very concerned about our kids. But that's why I'm saying pain is not the only factor. If you notice that there's a limp or a tilt, right? Because that is something that developed over a period of time. As parents, I think that you should just keep an eye out and get it checked out for the kids, because the sooner you fix it, the better it gets fixed, right? Because once the growth plates fuse, you really can't change the shape of the spine to a lot of degree.
Correct. So when you're doing those adjustments, even for baby, I guess it's very gentle.
Very gentle. The kid doesn't know. He won't cry. But
for adults, when you're doing it, the sound is a little unnerving.
Yeah.
And those adjustments or whatever, is it a very painful process, or how should it be? Because one fact for sure I know is, if I'm coming to you for a treatment, I have to completely surrender myself. Right? If I'm going to hold myself tight and you are going to do some adjustment, one is probably you won't be able to adjust because I'm tightening the body, right?
You can't, right? You need to be relaxed and loose. But the question comes down to, is it going to hurt? Now remember that if your bone is out of alignment, the nerves are getting pressed, which means those muscles have tension around them. It's sore to begin with. If I touch a point, you're already hurting, and I touch that point, it's going to hurt. But it should be sore. It really shouldn't be painful. In terms of patient feedback, I have noticed that the first adjustment, it feels very uncomfortable, because you have no idea what to expect. You're just going to the doctor because you heard the doctor can help you. And I have so many people who come in just looking for it's their last ditch attempt before going to surgery, which is already too late, by the way. But if you come in, I can still help you. But then the outcomes are quite, we don't get as much as we want out of the treatment. But we can still get you places that you would have never imagined you could without surgery. So it's a big win for them. But you're already in pain. If I touch even where you're in pain, it's going to hurt. The good news is, the moment the adjustment happens, healing begins.
Okay.
Yeah. So you might be sore. I warn my patients, you might be sore for a day or two, because now we remove the pressure, but the body still has to do the internal healing. I tell them to rest if they can after their first adjustment. I tell them to drink lots of water, because those sore muscles hold on to a lot of toxins, and we need to flush them out. We want to get those muscles loosened up.
Okay.
And honestly, once they get off the table, they recall it as a pleasant experience. It's just that discomfort, which even if I go to someone new to get my nails done, I would also be hesitant, like, oh my God, it'll be stiff and that sort of stuff. So that's part of the experience. But I have had almost no cases. I cannot think of even one at this point where somebody was like, you have broken me, or it hurts more than when I came in. You will feel sore, but it starts healing immediately, and you see the results within 24 hours. At least improvements, I would like to say. And then the body continues as we work on it. We start compounding on the positive impact of the adjustment on your body.
Right, right. And of course, exercise will go hand in hand, even after the adjustments and the healing process is done or whatever. I think strengthening the muscles and exercising will ensure that the body remains in that state, isn't it? In a healthier state, probably.
So that's when, so remember we talked about your responsibility before you come in to see the doctor?
Yeah.
Now this is where the responsibility becomes, more on the doctor, but also on you, right? Instead of that having an 80-20 split, now it's more of a 50-50 split. That's how I say it.
Okay.
So some of the responsibility goes off of you, but it's still your responsibility. When you surrender to the doctor, what you're surrendering to is you're basically giving the permission to the doctor to do what they want to do, or what they need to do. I shouldn't say want to, but what they need to do to get you out of pain.
Yeah.
So that's the surrender part.
Yes.
But then I also say that the doctor can only do so much for you. I cannot go and sit in my patient's office and say, your back should be straight, straighten your back. So my final outcome is based on you getting better, not you coming to see me more times. I don't see a correlation between the two, and that's not my aim either. My goal is that I teach you how to take care of yourself so you see less of me. So then that's where the stretching comes in. That's where the mobility, the strengthening. Sometimes we skip. I have a gentleman who I currently am treating, and I just said that I would totally skip strengthening right now. We need to get you mobilized first, because stiffness is not your friend when you're trying to lift weight. You're already guarded. You're going to injure yourself. So that's something that needs to be progressively changed, customized, and personalized to your needs.
Okay. So if you have to give one piece of advice for people to take care of themselves, sort of a preventive thingy, what would that be? Like their posture, exercise, what would that be? Like some takeaway for maybe the viewers to, okay, fine, I should really be serious about this.
Okay, so first I'll give is an example of something you can do to run a small diagnostic for yourself. Okay, it's very cool. It's something that I do, and I recommend my patients. Now, if you have balance issues that you can't walk, I would suggest don't do that. But if you're able to walk properly and you don't have balance issues, I want you to go in front of a full-length mirror. Okay, stand right in front of it. And if you can, make a straight line on it, like with a chalk or something. If you can't, don't worry about it. And I want you to look at yourself fully, but close your eyes. Okay? Once you close your eyes, I want you to march in place. At least 10 steps or 30 seconds. Just march in place for 30 seconds. And then hold still. And then open your eyes. And check for imbalances. Check where your shoulder is going off. Check how your head is positioned. Check if you... So we start seeing that. And you can do it in two ways. One, you're going to do it straight on, and then you're going to turn 90 degrees and you're going to do it sideways. For most people, you will find sideways to be more of an issue. Very few people are tilted, but quite a few of us are. But most of us are doing this. We're not straight, our line. If you look at it in the side, your ear should match your shoulder in terms of in the straight line. And it should match your hip, the center of your hip.
Correct.
If it's not in a straight line, you definitely need to get it checked out. So that's something you can do on your own to see if your posture is a contributing factor to your to any condition that may be coming up or that you already have. Another thing is what something we practiced in the US a lot is screenings, where we used to go to schools and we started screening young adults. We're talking preteens, teens, and college-going students. And what we do is a spinal check from the back. We see a dimple or a ridge that kind of goes in, right? And that's where your spine follows. We want to make sure it's straight and not curving. Because if it's like curving or off-center. So we want to check for scoliosis very early on, because that can be detected and prevented for a majority of the population. So that's a preventative measure that is happening on a national level in the US as part of their, gymnastics or their physical activity classes. They do that.
And I'm sure in India also that could be happening.
There are some places that do it. Yeah, they do it.
And even this kyphosis, we call it.
It's kyphosis, exactly. So we have that. But then what? Then what are the next steps which people don't know about it? All they say is straighten your back, straighten your back. Maybe there is a latent problem that we don't know, because you don't feel pain. Like, remember the kid who fell 10 times before getting up? He doesn't have pain. His body is still healing and very fast, very fast. Our healing power is very fast when you're very, very young. So we don't know. So we want to catch it. And that's why this is used as a tool to catch those problems before they become a problem. And so I would definitely say that that's something you can do at home. The other thing I would recommend is sleep. 8 hours of sleep, or whatever it is for you. For some people, it's really 6. Some people can do with 6, and that's fine. But have a regular sleep habit, because I treated a patient. I can't say for this story, because I think that shows up in maybe 30% of my patients who show up, that they are in the bed all night, they have slept all night, but they've not rested.
Okay.
I tell them to monitor your thoughts 1 hour before going to bed. What are you thinking about? A lot of people are problem solvers before they go to bed. They think too much about, what do I need to do next day? What is on their mind? And I tell them to just switch the script. If you're going to bed, if you can't do an hour, do half an hour. Read a favorite book, watch a funny movie, do something that you really like to do, and forget about all the problems. Because how you fall asleep is how your body is going to heal. The main healing happens in the night. That's the real reason why I said your effects are going to start 24 hours after the treatment, because it's when you're sleeping that your body can focus on the healing. Right now it's focusing on everything else happening that's happening around you. But when you're sleeping, it's focusing on rejuvenating the new cells, removing the damaged cells, and correcting all the problems that have happened in the day or even beyond.
Right.
So good sleep is very important. If you can correct that, half of your problems in your spinal at least will go away on its own. I promise you. Have an active lifestyle. I think that whether you are trying to lose weight or just trying to stay healthy, the more you move, the better it is. I recommend half an hour of walking 5 days a week for everyone.
Okay.
I mean, just right off the bat, just move the body. The more you move it, the better it is. The saying goes, motion is lotion. The more you move, the more you can move. Let's put it that way.
I hadn't heard this. This is good one.
Motion is lotion. Yeah, that's used widely in the US. So I can't take credit for this saying, but it goes around in our field a lot. So the more you move something, the better it is.
Okay.
And that's about it. It doesn't have to be. Health is not hard. We have made it hard because our life has become hard.
Yeah.
Our life has become more difficult than it is designed to be. And that's why I don't see chiropractic going out of fashion anytime soon. As a matter of fact, while a lot of jobs are going to get automated and AI and digital, chiropractors are always going to be needed for...
We will need you more.
Exactly.
Oof, I love the adjustments you guys do to the spine.
It's great. It's very liberating. I personally feel very liberated when I get an adjustment, because I actually stop. I just stop and start breathing a lot better. A lot better right after the adjustment. And I'm like, just give me a second. And I just take in that fresh air, because there's so much that happens in the body which we don't give it credit for. And a spinal alignment, say that you have a misalignment in your neck because you slept wrong. Well, the nerves that go to your legs have to go through the neck, don't they, to come out. So those messages are not getting passed properly. There might be delays in signaling systems, right? So we want to adjust the neck even if you have a lower back pain. I check the whole spine, because the whole spine is connected. And messages don't go one way, they go both ways. If I'm sitting over here and speaking to you, and suppose an ant bit me, that signal, that tiny signal is coming to my brain and it's processing it. So we want to make sure that the flow is going both ways, and that there is no interruption or delay. Those are the two things we're looking for.
Right. So even if something is wrong in the foot or the knee, it could be all connected to the spine.
100%.
So this adjustment that we do in the spine is impacting so many other parts of your body.
Every part of your body, for that matter.
Yeah. I really wish we have clones of Dr. Kruti in Pune and multiple other cities, because you do a fabulous job. I've experienced it. So I hope this, we get many chiropractors. I mean, the practice prevails and expands in India.
In India, it's a little bit difficult, because there's a lot of doctors who are practicing or call themselves chiropractors, but they don't have the formal and the intensive training required to be a chiropractor. If I'm touching your body, I better know everything about it. It's not just on a wing and a prayer, they say, that, we're just not praying and hoping something moves. It shouldn't be that way. There are lots of doctors who do workshops of treatment on how the technique, but they don't know the underlying cause of it. So how can they help you beyond the moment you are there in the office? So it's your protocol, it's your prerogative actually, if you want to work with a doctor in that field or not. And some doctors do amazing things because they are gifted, and it's totally up to you. The risk is in, I told you that you are bearing the risk till the moment you go see the doctor. So it's all on you, and it's your responsibility to go into the doctor's practice and credentials and understand their process before you start engaging in it. That way you will lead to less disappointment, and you would be encouraged to move along in your health process. But as far as India goes, currently there are no chiropractic schools. So we don't have the workforce that is required to address the billion plus population that we have over here. My goal and my aspiration is that I can do my part to heal the people that come along my way, and give them the best life that they can have. And there's some great orthopedic doctors too that exist, but the only way to know is actually go and have that experience with them first.
What are your observations in terms of the cultural differences or the acceptance or the openness towards going to a chiropractor between US and India, if you have to compare?
Well, because it's been in the US for over a year, I think more people know about it, but it's still a surprising small amount of what it should be really in the US, given the access to care that people have. A lot of insurance companies also cover chiropractic care. It's that vital as part of the corporate life. And that's something I've done in the past as well, where I go to the corporate offices and I've done treatments for their employees. In India, it's still picking up now, because a lot of corporate companies have American counterparts. They do communicate, and people are aware about it more. But that number one, there is that risk thing. People think that there is a risk in doing that. People are scared. They don't know the person. I'll tell you that most of my patients come through referrals. In US, the acceptance is a lot higher. People seek chiropractic care. Like I said, we are considered a primary care provider, which means that even if some people are sick, they come to the chiro first before they go see the medical doctor. Yeah. And in India, it's the opposite. I'm actually I'm the last step before the emergency room. That means that they have already been to doctors, therapists, all these esoteric practices. I had a patient who once said that they went to a practitioner who, he had a disc bulge, and the doctor was very confident because he was third generation doctor. Doctor, I use those words. He's not there's no formal education. And he says that, you have a lower back pain. He laid down a patient. Remember, the patient is in severe low back, 21-year-old gentleman who busted a disc. And he's stepping on top of the doctor is walking on top of I said, this is going to get all better. It's all going better.
Oh my God.
So that's why I'm saying, if you're an informed patient, you can know what's right and wrong for you, because that would be the worst thing to do. He was desperate, so he went there. He realized it got him nothing, but it was not even a one-on-one care. I think there were 7 people lying, women and men included, and they were walking on it and on the spine. And I would never put that kind of pressure on a busted disc. It doesn't make sense to me. So you have to be very wary around here.
Wow.
You can't just go by experience of what somebody else had, because you might be looking for something else in terms of your preferences. As simple as that.
As simple as that.
As simple as that, yeah.
Ooh, walking over the spine.
Goodness. Many people do that. This is not a new thing. Apparently, it's a norm over here. So that's new. That would that would never be allowed. I mean, it's new for me, but this has been doing for centuries. So people think that, that's how it's supposed to be done, but that would not exist in the US. That's malpractice. You would immediately get sued over there. That's not allowed. So our professionalism is a little bit different. Patient acceptance is different. We use it as preventative. I have a lot of patients in just part of the regular routine. I mean, people say how often you should come. Honestly, the answer is once a week. It's once a week for everybody.
Okay.
But in India, I've noticed if I can get someone to come even once a month, it's a success story for me, because we have more reasons to not take care of ourselves than to take care of ourselves. And because maybe over there it's more accessible, because you have doctors nearby. I don't have to travel across the city to come see a doctor, which is why I appreciate and I understand. I think once a month is also great. And it's a tune-up. If you don't take care of your car, it is going to break down. It's kind of like that. So
it's like servicing your spine.
You're servicing your spine.
Yeah.
And then I had another person come in. This was a funny story. It happened last year. And the patient, she had come to me when her knee was already stage 4 degeneration. There's nothing I can do for it. It was a surgery case. But then she decided to go for the less invasive, where they put the gel and just gave it a cushion, which I personally told her, I think you should do it. I can't help you, and I don't intend to promise you something I can't deliver on. So I said, that's best. And then she decided that she still needed care, which she did, because once you put the gel, you still need to learn how to walk. You're reconfiguring your body. You've got other things to take care of. So if you want it to heal in your knee, you need to take care of your back, because those nerves go directly over there. So we did that. And she was great in about 1.5 to 2 weeks of post that, because she got the treatment also done on the back while she was getting the treatment for her knee. Then she was getting ready to go back to the country she came from. And she said, so they said that this is only going to last me 6 months. I said, yeah. Gel does not last more than 6 to 8 months.
Okay.
Yeah. So she asked me, well, but you told me that I had to walk 5 days a week. I'm not going to walk. I said, okay. She says, yeah, the doctor said the more I walk, the faster my knee wears out. And then I had to give that example. Imagine if you have a car and you never turned it on, you never let the engines run. It's going to go out faster. You need to walk.
Oh.
You need to give that motion so the body does what it's supposed to do, and you will pay less price for it. Let's put it that way.
I have experienced it when I've taken treatment with you and earlier chiropractor also. Is when I'm walking out, I'm feeling so much lighter, and there's a bounce in the walk. And,
It is.
You know, you're breathing well.
You are breathing well.
Breathing so well and stuff like that. So yeah. I hope this practice grows and expands in cities in India, because it does really wonders on the back, and I think naturally if there are more people practicing there, the fear will go away, because right now it's an unknown thing for many people.
It's a very, very new concept.
Very new concept.
It's just taking, it's even like pre-birth. It's not even taken birth yet in India. And people view it very differently in India. I've had, they think of it as, like I said, it's an entertainment. I see a lot of likes and views and stuff when patients come and share those videos with me. But they are being shared on for entertainment, which there is so much more to it.
Yeah.
There's a lot to it.
And this was new for me when you said that, the cracking sound doesn't come all the time. I've seen a lot of reels of these guys in eastern parts of the world where they're doing the cracking and there's huge cracking sound. And I always wonder, is it artificially generated?
It is. It's all superimposed, because there's no way that even a mic would pick up that sound, even though it can be loud to you.
And
it doesn't get picked up.
It's so loud in those, my God, social media can be harmful in so many ways. On that note, wow, this was a wonderful session. We can go on.
We can go on. There's a lot to say and a lot to learn.
We can do one more session, one more episode of our podcast. But thank you so much.
Ming, I really enjoyed sharing my viewpoints.
I'm so happy I could create this forum for you, and I'm sure the viewers are going to enjoy, listening. And do leave your comments and your feedback on how you found the episode and what more would you like to know about this practice.
And they can.
Thank you.
I'm sorry. And they can also leave some questions if they have underneath. I can go in and answer the questions
as well,
to the best of my ability, maybe about this practice, and maybe we could use it as a jumping point for our next video. Absolutely. If there's enough questions.
Yeah. Thank you.
Thank you.
Thank you, Dr. Vora.